right. Good afternoon, everyone. Thank you for joining me here today in Edmonton for an update on the work our government is doing to improve our healthcare system. I'm joined today by MLA Martin Long, Parliamentary Secretary for Rural Health, by Marty Scott, Executive Director of the EMS Provincial Programs with Alberta Health Services, and Tim Ford, Registrar of the Alberta College of Paramedics. Together, we will outline significant steps our government and partners are taking to enhance emergency response capabilities and healthcare across Alberta. At the forefront of our emergency medical services are the dedicated paramedics and emergency responders who tirelessly serve our communities with commitment and compassion, ensuring Albertans receive the critical care they need in times of crisis. And I can't thank them enough. So to all of our paramedics and first responders, thank you so very, very much for all that you do each and every day. They are at the front lines. They are heroes and have an invaluable role in safeguarding the health and well-being of our citizens. Their dedication inspires me and reinforces the need for our government to support our frontline care providers however we can, so that they can do their job effectively, efficiently, and safely, and so that every Albertan, regardless of where they live, receives timely and quality health care services. Albertans deserve an EMS system that is equipped to meet their needs, which is why, as part of Budget 2024, Alberta's government is allocating funds towards reducing emergency response times. With an additional $25 million allocated to the Emergency Medical Services EMS Vehicle Capital Program, part of a total investment of $35 million over 3 years, we are bolstering our emergency response capabilities. So this funding will support the replacement of EMS vehicles at the end of their life cycles and ensure existing vehicles are adequately maintained and equipped to meet the diverse needs of both urban and rural communities. So these investments are pivotal in enhancing system capacity, stability, and response times. They also provide our dedicated EMS practitioners with the necessary resources to continue delivering exceptional care to Albertans in need, further solidifying our commitment to deliver timely and accessible healthcare services. It's imperative that Albertans who require emergency transport to hospitals or other healthcare facilities receive the care they need when they need it. And this investment will facilitate just that. In addition to this investment, I'm pleased to announce that Alberta Health Services has awarded contracts to 2 partners to provide scheduled, low-acuity, interfacility transfer services. These contracts in Calgary and Edmonton will provide non-urgent transfer services, bolstering the resources of our EMS system. So this strategic initiative will enable Alberta Health Services to help ensure that ambulances and paramedics are available to respond to emergency medical calls in Calgary and Edmonton and the surrounding areas. So these contracts underscore our commitment to strengthen EMS supports so that we can work to enhance critical care services for all Albertans. So Alberta's government also remains, Alberta's government also remains steadfast in ensuring the province has an efficient and effective air ambulance program and a strong and supported paramedic workforce. Budget 2024 allocates $2 million for an independent review of our provincial air ambulance program and a comprehensive paramedic workforce study. So this work will assess the current state of Alberta's air ambulance fleet and paramedic staffing levels to ensure optimal coverage and response times. These initiatives are vital in informing future improvements to our EMS system, ensuring it remains responsive and effective. And they also align with our commitments to provide timely care and to equip our first responders with the resources they need to save lives. So by investing in our emergency response, transportation fleet, and workforce development, we are positioning Alberta's EMS system to respond to emergencies faster so that timely and quality care can be provided to all residents across this beautiful province. Together, we can ensure a healthier, safer, and more resilient future for all Albertans. So thank you very much for attending, and I'll now invite Parliamentary Secretary for Rural Health, MLA Martin Long, to the podium. Thank you.
Good afternoon, everyone, and thank you to Minister LaGrange for this announcement. I'm very happy to be here today with the Minister of Health to talk about the work being done to provide timely access to health care for all Albertans. Significant strides are being made to enhance emergency medical services across Alberta. Budget 2024 reflects government's unwavering commitment to ensuring timely access to health care for all Albertans, regardless of where in the province they call home. One of the critical elements in delivering swift emergency care is the efficiency of our EMS fleet. This Budget 2024 investment in the province's EMS vehicle fleet will help support the rural Albertans I represent. The efficiency of EMS fleets is crucial for rural Albertans because it directly affects timely access to life-saving medical care. In rural areas where distances between communities and healthcare facilities are often significant, efficient EMS services during emergencies save lives and improve health outcomes. The work that will begin on the air ambulance review and the paramedic workforce study will help to ensure that the future state of emergency services in this province supports rural, remote, and Indigenous communities. Specifically, the air ambulance review will have significant impacts on rural Albertans by helping to optimize EMS response in remote areas. This is crucial in rural communities where access to medical facilities can be limited. Air ambulances are often the fastest means of transporting patients to higher levels of care. A workforce study will assess the availability and distribution of paramedics in rural regions, identifying areas with shortages and recommending strategies to recruit and retain paramedics in those areas. This can lead to increased staff levels, improved response times, and better quality of care for rural residents during medical emergencies. These initiatives are not just about addressing current challenges, but also about laying the foundation for a more resilient and responsive healthcare system that ensures every Albertan receives the care they deserve regardless of where they live. I will now turn it over to Marty Scott, Executive Director with EMS, to provide comments.
Thank you, MLA Long. On behalf of HSEMS, I'm happy to welcome you to Northwest Station, to the Minister, to Mr. Ford, and of course, MLA Long. It is indeed great to have you here today. Before I start, I want to take a moment to recognize and thank the many people that make this EMS system work in Alberta. No matter your role, every single one of you help keep Alberta's communities safe and healthy, and we see this in your commitment every day through the efforts of frontline paramedics, emergency communications officers, professional staff, leaders, and our service partners. We are committed to improving the EMS system to support what you do each and every day. As been noted, this funding, as well as our new partnerships, will help us to continue to focus on improving EMS response times and providing better service. The funding for ambulances and equipment outlined by the Minister and MLA Long will help us maintain a modern fleet and equipment to support our goal to provide the best care to Albertans. In addition, by working with our partners for non-urgent, low-acuity scheduled transfers, 45 new resources are being added to the emergency medical services system. 26 of these resources will be in Edmonton and 19 in Calgary. They will be phased in starting in June and July until they're fully in place, which is expected later this calendar year. By focusing these resources on non-urgent interfacility transfers, we can direct our current EMS teams to improve EMS availability for 911 response, help keep ambulances in their home community, and allow paramedics to finish their shifts with reduced overtime. These additional interfacility transfer resources will help ensure that non-urgent patients that require transport for treatment or diagnostics will arrive on time for scheduled appointments, which supports their own individual care plan. AHS also remains committed to the EMS Return to Service initiative that has significantly reduced the amount of time that paramedics spend in emergency departments. AHS teams, including our acute care colleagues, continue to implement strategies to further impact return to service times. These efforts improve EMS's improve our availability in communities. They improve our response times, and they enhance the career satisfaction of our paramedics to be in communities providing service where they belong. We know that supporting paramedics and emergency communications officers are paramount. Alongside these measures, we are actively working on improving EMS in the workplace. For example, to reduce fatigue, we've implemented alternate shift schedules, rotations, and hours of work, and launched a strategy to aggressively recruit more talented members to our team. However, despite these steps, we know there's more to do, and we welcome the province-wide review of the paramedic workforce and its findings. Finally, we also look forward to supporting the review of the air ambulance program in Alberta. Each year, in conjunction with our service partners, over 10,500 patients are transported by air ambulance in Alberta. 9,000 of those patients are flown by our 11 fixed-wing air ambulances, and over 1,500 shorter distance events are completed by 5 rotary wing resources. We anticipate the review will identify how to further improve these services to ensure we are providing the best care possible to Albertans. So thank you. I'd like to turn it over now to Mr. Tim Ford, Registrar of College Paramedics.
Thanks, Marty. And good afternoon. Thank you to Minister LaGrange for the invitation to speak here today on behalf of the Alberta College of Paramedics. As the regulator of close to 9,000 paramedics and emergency medical responders working in both public and the private sector, I can confidently say that the continued support of this government in addressing our members' concerns is vital to building a strong, effective healthcare system. We saw a great example of this support with the adoption of the Alberta EMS Provincial Advisory Committee report early last year. Many of the recommendations that came from that committee were a direct result of feedback from our members through several town hall meetings and surveys. A number of these recommendations have been put into action, with ongoing reviews taking place to ensure that these action items are achieving the desired results. Today's announcement of increased funding to rejuvenate the EMS fleet and the launch of the paramedic workforce study are further evidence that there remains a commitment to ensure that our members have the resources to provide excellent care to Albertans in their time of need. There will be more feedback opportunities in the coming weeks related to the paramedic workforce study, and I encourage all of our members to take the time to participate. We look forward to continuing to work with our partners and the government in building a strong and supportive EMS system, because well-supported paramedics provide safe and effective care to Albertans. As paramedics on the front lines of emergency care, let's do what we can to ensure that our partners in government remain acutely aware of the issues we face, and I want to assure you that your voices are being heard. Your input has and will continue to have a vital impact on future decisions. Thank you.
All right, thanks folks. Thanks to all our speakers. We'll now turn it over to media for questions. So just a note to any media in the room, please line up at the microphone to ask your questions. And if you would please mind keeping your questions to one question and one follow-up, we'll circle back around for additional questions if you want to rejoin the queue after you've asked your one question, one follow-up. And we'll start with reporters in the room. Seeing none at the mic, we'll go over to the phones. Operator, please put forward our first caller.
Sarah Austin, Global News. Hi, Minister. Thanks for taking my question. I wanted to ask specifically about rural ambulances being called into the city. It's a concern that we've heard from a number of communities, specifically around the Calgary area, speaking with today in Exshaw, who talked about waiting 2 to 3 hours while the Kananaskis ambulance was called into Calgary. And now there's since been an ambulance in place in Exshaw, but it's certainly not an isolated incident that we've heard. Can you talk about how these changes are going to address some of those concerns from rural residents, and how quickly we're going to see those changes in place?
Well, I'm happy to say that we've actually seen positive change. At least I know since I've been the Minister of Health, I've seen the numbers drop down in terms of the response times, the time it takes for an ambulance to get to a scene. Also, I've seen the numbers when they come into hospital, that turnover time is improving. We've seen a decrease in the number of red alerts and the amount of times for red alerts, so that's very positive. These additional dollars will go a long way to make sure we have additional ambulances. Obviously, additional staffing will be included as well, and also making sure that on those low acuity, the interfacility transfers, that we're not using up ambulances that could actually be out on the higher acuity ones. And so I know that as the other speakers have said, we're seeing improvements, but we know more has to be done. I'm happy to turn it over to AHS Director Marty Scott, if he'd like to add anything to that, because I know they're dealing with it on a day-to-day basis, so please.
Yeah, thank you, Minister, and maybe just to augment your comments. One of the challenges that we've had in the system that I think is well known is the amount of time that we do spend in emergency departments. And while that might not seem directly related to the rural community, it actually is. As resources get pulled into the city, we continue to backfill, and I think that's been well reported and documented. The more resources we have in the city and the faster we can get paramedics out of emergency departments, and don't just think Edmonton and Calgary, but think Red Deer, think other regional communities that have hospitals, that makes a big difference. And the Minister indicated that the amount of time in hospitals decreased. It certainly has. In February of 2024, we were on an average of 88-minute wait time for an ambulance in an emergency department. And in November of 2022, that was actually 215 minutes. So we've seen substantial improvement in availability of resources. And I'm confident that with the additional 45 units provided in the metro areas, that we'll further see EMS in communities in those regional areas as well. So hope that helps.
Sarah, did you have follow-up?
Thank you, Bob. Yeah, I'm just wondering if you can clarify anything about the time for the review of both air ambulances as well as staffing of EMS.
So my understanding is we've RFP'd that review out to an independent company, and they will be starting immediately. I anticipate a report by late summer, early fall. That's the original timelines, but again, dependent on making sure that they connect and are engaging with the stakeholders that need to be engaged with.
All right, thank you. Next in the queue, please go ahead.
Jordan Kerrigan, CTV.
Hey there, thanks for taking my question. I actually do have a quick follow-up that I don't think you answered Sarah's question. Just wondering when those non-urgent transfer services will be operational. And another couple of questions about those non-urgent services. When it comes to those Calgary and Edmonton-based services, how far will they be traveling outside of the city, and how is that distance decided upon? And what do people outside of those transfer areas do?
I think that's very technical questions. I'm going to turn over to our expert here.
Thank you, Minister. I think I caught most of the question, so please let me know if I don't get to all of it. The resources are going to be in place. They're going to start in June and July, maybe a little bit earlier. We've just recently signed these agreements, and so those partners are actively getting ready to provide service. There is a 50-kilometer radius that we've selected, and I think your question was, how did we come up with 50 kilometers? We actually looked at our data related to how often low acuity patients were being moved in and out of the metro centers from those communities, and we looked at the demands on their local EMS resources and essentially determined that considering that 50 kilometers is not that far away and considering the benefit to the rural community of not sending their local resource, for a low acuity patient, we felt that that made good sense. And that's how the capacity is going to get added back into those rural areas that are around the city. I'm not sure if I caught your entire question. I hope that addresses it.
It did, thank you, and I appreciate you answering all those and catching all those. Another question for the minister, and this is a little off topic, but we've been hearing more from healthcare workers, especially since April 1st, when it comes to parking fees at facilities going up. Is there any consideration to exempt healthcare workers from paying parking fees? And just wondering if you could answer why they have to pay those increased fees.
Well, the fees for parking really are recouped by Alberta Health Services and go back into maintaining parkades, building new parkades, etc. There actually had not been an increase for over a decade, is my understanding, and so AHS really has to be, maintain a cost neutral on that, and so they were finding that they were getting into a deficit position with their parkades. So it really, if there's anyone who has an issue or a concern or finding difficult paying those fees, they can certainly have those discussions with Alberta Health Services. But at this point in time, as everyone knows, the costs have gone up in every area. Inflation is hitting Alberta Health Services as well in maintaining the parkades and in making sure that that they're able to build new ones as the need arises. So at this point in time, there is no indication for what you were asking.
All right, thank you. Next in the queue, please go ahead.
Catherine Kragowski, Alberta Today.
Hi, thanks. I'm wondering on the air ambulance services, as part of the review, will there be any consideration into bringing those services under the public health system, or is the idea to keep them as their own separate entity?
Well, obviously emergency services need to be an integrated service, and they work very well the way they're going right now. Part of the review will be exploring how we can improve the services that we currently have. Is there any gaps? What are the workforce needs that maybe are not being addressed that we need to address? Do we have the right equipment in our ambulances and on our air ambulances, et cetera? Do we have the right trained staff, et cetera? So it will be reviewing everything. I'm not sure if there's anything you'd like to add to that. No? Okay. Is there a follow-up?
Yes. Oh, yeah. Sorry.
Sorry.
I wasn't sure if you're done or somebody else was going to hop in.
Yeah. No. Sorry.
So earlier today, the NDP held a news conference on the changes to the continuing care standards, and they say that these flexibility in regulations are going to harm the quality of care people get. There was a report on the compliance of those standards in continuing care. They found failures to give people baths twice a week, that infection control standards weren't followed. I'm wondering, how does this flexibility translate into improved care for patients?
Well, first of all, the regulations for the continuing care legislation, the legislation itself, although it was passed last year, only came into effect on April 1st, so really just 11 days ago. The regulations came into effect as well. We've gone from a 1.9 hours for continuing care to 3.62 funded hours per individual that needs it. And so, while I look at the investigations that were listed by the NDP, and they are very transparent. They're on the website. I encourage people to go have a look at that. I have actually bolstered the investigation department so that they can do more investigations. Part of the new regulations really talks about the safety, improved safety, and being able to deal with concerns and complaints from individuals. So the fact that I see numbers rising in terms of the complaints, I'm glad that people are reporting things and that they're being investigated and that they're being dealt with, because that will give Albertans the assurance that when someone goes into continuing care, that they are in fact getting safe, reliable, good care for their loved ones.
All right, thank you. Next in queue, please go ahead.
Carly Robinson, City News.
Hi there. This is both for AHS and the Minister. Here in Edmonton, the fire chief started off the month by saying they are no longer responding to non-urgent or less urgent medical calls. I'm wondering if this has had an impact on EMS services in the region as well as response times.
Well, my understanding is that every time an ambulance is required, it is sent out. Obviously, it's triaged by dispatch, but it is sent out. You know, we very much appreciated the great work of the EMS fire medics that were attending. That being said, it is a decision by the local municipality in those instances, but my understanding is that ambulances go out each and every time. Perhaps you'd like to augment that?
Yeah, Minister is correct. We absolutely do send an EMS resource to every call for service where it's needed. I do want to be very clear that we're very pleased and happy with our relationship with the Edmonton Fire Rescue Chief and the decisions that they've made. One of the recommendations that came from APAC last year that we looked at was related to making sure that fire departments are being requested for medical events in a way where it would have a positive outcome for the patient. This in part is related to some of that work. We had an opportunity to discuss this with the City of Edmonton in their decision-making process, and they determined that there's some of these events that they don't need to go to. We actually support that decision. We're very confident that Edmonton Fire will be there for us and for the patient when we need them. And I would probably just say they don't align perfectly, but this is fairly close in practice to what we've been doing in the City of Calgary for some time. So hopefully that helps.
Thank you. And just on the topic of the medical transfers, the Health Sciences Union put out a statement saying that this is just another step towards privatization. And we're wondering what safeguards will be in place to make sure this continues to be the best quality of care for patients.
Well, this is just, you know, again, transferring low acuity individuals that need to go between health facilities. It relieves pressure on the overall ambulance system so that the higher acuity ones can be dealt with by the paramedics who have the advanced life-saving capabilities. So we do audit, as does, you know, emergency services, so we will be keeping a close eye. This is a contractual obligation. If people don't meet their contracts, those contracts can end. I'm confident that the winners of the contract are able to carry through. We've had pilots in place for a little while now, and I've heard great successes have happened from those pilots, and happy to have you augment further if you'd like.
Thanks, Minister. I want to be just provide a little clarity on how the providers will work for interfacility transfers. They'll continue to report into Alberta Health Services under that agreement. They will be dispatched by Alberta Health Services. They'll use protocols from Alberta Health Services, and they'll meet standards set forth by provincial legislation for ambulance services. So I want to provide some level of confidence that they'll meet a high standard for the level of work that they're doing. In part, this work was informed by some work the Minister alluded to in Red Deer, where we added dedicated interfacility transfer resources to take burden off of rural communities. All of those resources were in place of July of last year. We're going through a more methodical review of the impacts of that. However, very, very quickly into the pilot, we recognized that rural communities were experiencing better coverage because resources were being sent out from Red Deer to take patients rather than sending the local resource. So it is a lesson learned from that at a very early stage.
Awesome, thank you. Operator, please put through our next caller.
Michelle Belfontaine, CBC. Oh, thanks for taking my question. Minister LaGrange, I was hoping to follow up on the, I know my colleague Kat Krakowski asked a question about the NDP newser, and I have some additional questions about the inspections of continuing care and supportive living facilities, and there's 90% in 2023 were non-compliant. And I know that you say that there's funded hours that you're providing these care facilities. So it's not the same as putting a number into regulation, compelling operators to provide that level of care. So given that 90% of these facilities were non-compliant, or I should say 90% of the inspections last year were non-compliant, does this make you think twice about dropping the prescribed hours of care from the new regulations?
Well, the non-compliance was for a variety of reasons, like when there's a complaint that comes in, it could be for anything, you know, from A to Z. So, you know, I'd have to dig into those specific cases. But again, the fact that we're auditing, that through our contracts, we have the ability to go in and audit those individual continuing care homes to make sure that the clients, the patients, the residents that live there are getting the best quality of care. In fact, with the regulations, we are reinforcing the fact that we need to make sure that these facilities are safe. We have vulnerable people going into continuing care, and we want to make sure that every individual is safe within their continuing care home, that they're getting, you know, proper nutrition, proper care, that they are in fact following through with the level of care that is required for those individuals. And some individuals need way more than 3.62 hours, and we want to make sure that those individuals are getting exactly the care that they need.
But as a follow-up, I mean, given that these are very vulnerable people, is it wise for the government to be reactive instead of proactive? Like, you know, it sounds like your inspectors will go in when there's a case, right? Or they find something when they go in to inspect, but people could be suffering. So I'm just wondering if that approach, I don't know, do you feel that approach is the right way to go, to be reactive instead of proactive?
Well, we are proactive. These are regulated, licensed facilities. They have to meet all the regulations. They have to meet all the requirements to be licensed. They're constantly monitored. They have regular safety inspections. Everything that is required in a regulated, licensed facility is done. And then on top of that, if there's a complaint, we have a process that is actually beefed up now because I've added more people to be able to do that process in a more timely fashion, that actually goes in and investigates and then makes sure to follow through that any non-compliance for any reason is dealt with. So I would say we're very proactive, and then we're also reactive as well. So I believe we have it all covered.
All right, thank you. Operator, please put through our next caller.
Jacqueline Carmichael, Edmonton Journal.
Thank you. I have a question on another topic.
Sure.
I'm wondering if the province will reconsider and hit the resume button on the South Edmonton Hospital project that it paused last month.
So the South Edmonton Hospital, when I became the Minister of Health, I was education for 4 years. When I became the Minister of Health, as I was being briefed on the various capital infrastructure projects across the province, it became apparent that the South Edmonton Hospital costs had ballooned to just shy of $4.9 billion for a 400-bed hospital. It would be the most expensive hospital in all of Canada. And it also became very apparent that when it was first announced by the NDP in 2017, 2018, that it had no business case, none of the requirements to bring it forward. In fact, other reports that I've seen show that where a hospital is needed is not in the south, but in a different part of Edmonton. So we're actually looking to, right now with infrastructure, we've got an $88 million fund to look at what can we do to revitalize, like do planning with some of the other facilities that we have. We've made a commitment to build a standalone Stollery hospital, which is much needed because right now they're spread out over 4 different facilities with 11 different programs running, et cetera, and it's very, you know, in some instances, not very child-friendly at all. And we need to correct that. So that commitment is moving forward. We're looking to see where we have space in other current facilities. I've been made aware of other hospitals that have floors that are empty that we could revitalize and start using at a more cost-effective manner. And then we're also looking at this $88 million fund to do planning right across the Edmonton zone to see where we can really enhance services to Edmontonians in a quicker, faster fashion to meet the needs of Edmontonians today.
Jackie, did you have a follow-up?
Yes, we have some complaints of rural doctors requesting ambulances that were either being denied or delayed. And do you anticipate that this will help those rural doctors when they make a request, have it followed up with an actual trip to city care?
I found it difficult to hear the question. I think the question you asked was rural doctors are finding it difficult to get ambulances to come in a quick fashion. Will this improve? Am I correct? Is that the question?
No, I'm sorry. The question is, will it improve the rural doctors when they make requests for a transfer to the city, for them to get that transfer to the city, to city care for a patient?
Will it improve rural doctors being able to get that interfacility transfers quicker, is I think what you're asking then. So my assumption will be yes, because we will have more ambulances on the road, we will have more ability for these specific interfacility transfers, but I will turn it over to the expert.
Yeah. Thank you, Minister. I would say earlier I referenced that we had put in a IFT resources in the Red Deer area. That definitely has improved the availability of resources in the community for emergency events, but as well as for transfers. Springboarding off of this additional work that we were doing in Edmonton and Calgary, we're examining other areas of the province where we can further do lower acuity scheduled events that don't require full-blown paramedics and fully equipped ambulance in order to provide some capacity to the system and keep paramedics on the task that they were trained to do. So I am actually not, I know there in some cases there have been some delays in looking for transfers. In some cases those are usually related to ones that are scheduled, that we don't make our schedule pickup time because we're actually busy with response in community. And so to the Minister's point, more resources will help that. Dedicated resources for interfacility transfers for the low acuity side, which allow us to focus on 911, will definitely help. But I do also want to say that in those cases where if the transfer is dire and they're in a rural community, this is exactly why we have a system of EMS in this province, where that's where we'll deploy air ambulances to take those patients if they have to make it and there are no resources available. I'm not aware of any dire cases like that. However, the announcement today definitely will bring some more capacity in that regard.
All right, thank you. Operator, do we have anyone else in the queue? Operator?
We lost the operator.
There are no new questions in the queue at this time.
All right, thank you. Thanks, everyone.
Thank you, everyone. Thanks.